If you've been battling with chronic tendon pain, that nagging ache in your heel, elbow, or shoulder that just won't go away, you know the frustration is very real. You've probably been trying everything the traditional medical playbook offers in the cycles of rest, ice, over-the-counter pain relievers, grueling physical therapy sometimes, and stretching routines that yield only temporary relief. But what happens when that pain settles in for the long haul? The problem is many of the chronic conditions involve stuck, fibrotic, and poorly healed tissue. Your body stops actively repairing the area. To truly fix it, you need a different kind of tool, one that physically forces the tissue to restart its healing process from scratch. That tool is shockwave therapy. Its technical name is Extracorporeal Shockwave Therapy, or ESWT. It sounds intense, and while it uses powerful acoustic sound waves, it is fundamentally different from a simple ultrasound. This is a highly targeted, non-invasive treatment that uses immense, focused mechanical pressure to break the cycle of chronic pain, simulate genuine, long-term tissue regeneration. It is an effective, evidence-based alternative to risky steroid injections, repeated anesthetic nerve blocks, or even surgery for many persistent musculoskeletal tissues. This guide is your nonsense deep dive into the technology. We'll explore what shockwave therapy actually does inside your body, which frustrating chronic conditions it can decisively help resolve, the powerful science that backs it up, and exactly what you should expect when you step into a shockwave session. Shockwave therapy is based on a surprising simple premise: applying a controlled therapeutic amount of high energy to a damaged area to trick the body into acute healing state. This is a critical distinction because the chronic state is where the body's repair system goes to dormant. ESWT uses acoustic waves, which are mechanical pressure pulses generated outside the body and delivered precisely to a targeted tissue. When chronic pain sets in, the tissue is often characterized by disorganized collagen fibers and scar tissue, fibrosis. This tissue is weak, painful, and lacks proper blood supply. The shockwave machine transmits focused energy that penetrates the skin without harm and converges precisely on the site of damage. Be it a painful tendon insertion, a ligament, or a deeper trigger point, this focus energy creates a cavitation effect within the tissue, which generates high stress forces at a cellular level. This micro trauma, though controlled and therapeutic, is violent enough to cause a cascade of very powerful biological and chemical effects that reboot the healing process. This starts by stimulating angiogenesis, which is the creation of new small blood vessels. Chronic pain areas are often starved of oxygen and nutrients due to poor circulation, so increasing the blood supply is the body's first step in regeneration. Simultaneously, the energy physically breaks down calcification and scar tissue, the hardened, disorganized tissue that often accumulates in areas like the shoulder or the heel. By mechanically disrupting this tissue, the body is forced to reabsorb the debris and lay down new, healthy collagen fibers. Crucially, the process provides an immediate analgesic, pain-blocking effect by stimulating nerves in the area, reducing your pain sensation while the deeper healing takes place. Furthermore, shockwave influences the cellular environment by promoting the release of chemicals that attract mast cells and other key inflammatory mediators, which essentially converts a stalled, chronic, low-grade inflammatory state into a short, acute, therapeutic inflammatory state necessary for healing. In short, shockwave therapy is a direct, non-chemical assault on the stuck tissue. It bypasses the body's indifference and sends a powerful, unambiguous biological signal that screams, "There's a massive damage here, repair it immediately." It forces the body to restart the healing clock and finally finish the regeneration job it had previously abandoned, transitioning the tissue from chronic degeneration to active acute repair. Conditions where shockwave delivers results. Shockwave therapy's strength lies in its specificity. It's not a generalized treatment for all pain. It is exceptionally effective for chronic conditions where tissue failure, calcification, or poor healing is the undeniable root cause. The clinical evidence is the strongest for specific musculoskeletal pathologies, particularly in those involving chronic tendinopathy and tendonitis, where the painful condition involves a tendon that has failed to heal, and also areas where the body has low oxygen, chronic fibers, tissues that is just not healing. Plantar fasciitis, or chronic heel pain, is arguably one of the most common successful applications of shockwave therapy globally, with studies showing significant higher success rates than traditional modalities. The therapy directly breaks up the tight fibrotic tissue and calcifications that often form as heel spurs, while stimulating massive blood flow to increase to the area, providing definitive long-term relief where months of stretching and shoe inserts have failed. Similarly, for Achilles tendinopathy, where there is an insertion pain at the heel bone or the mid-portion tendon pain, Shockwave targets that exact insertion point of the tendon, forcing the formation of healthy, strong collagen and eliminating the characteristic chronic dull ache. This is also true for patella tendinopathy, or jumper's knee, where ESWT stimulates a strong healing response in the tendon just below the kneecap. Lateral epicondylitis, some people call it tennis elbow, and medial epicondylitis, some people call it golfer's elbow, are classic examples of chronic tendon degenerations. ESWT focus precisely on the tendon attachment, points near the elbow joint, helping to reorganize the damaged tendon fibers and relieve the constant pulling sensation that makes simple tasks like gripping or lifting intensely painful. Furthermore, rotator cuff tendinopathy in the shoulder, especially in cases where calcification has occurred, responds really well. The acoustic waves mechanically fragment the calcium deposits, allowing the body to reabsorb them, which restores joint mobility and eliminates that sharp, painful catch that limits shoulder movement. Beyond tendon issues, Shockwave also has other chronic applications. It has a long history use in orthopedics for non-union fractures or bones that fail to heal. By stimulating blood flow and osteogenesis, bone formation, the therapy can restart bone remodeling processes and often avoid surgical intervention. Additionally, it is highly effective at releasing deep, stubborn microfascia trigger points, those tight, knotty areas in a muscle that are referred to pain distance from the body. The acoustic energy helps to mechanically break up the hypercontracted muscle fibers, restoring normal blood flow and muscle elasticity that was previously restricted by chronic tension. What to expect during your session? The word Shockwave can trigger intimidation, but the actual procedure is quick, predictable, and manageable. Understanding the process removes the fear, and the sessions are actually pretty quick, usually lasting about 5 to 15 minutes long. The first step is precision location, which is absolutely critical. The practitioner must precisely locate the painful damaged area through a combination of manual palpation and sometimes guidance to ensure the acoustic energy hits the exact site of the chronic damage and not just the surrounding healthy tissue. Once marked, a coupling gel applied to ensure the acoustic waves transmit smoothly from the machine's applicator head into the body. During the treatment, the head is pressed firmly against the skin and moves slowly over the target area. The sensation begins mildly, but quickly builds to a rapid, heavier tapping or deep thumping. The intensity is gradually increased based on your feedback. The goal is to reach a level of therapeutic discomfort, enough to ensure a biological effect, but not intolerable. Many patients report that initial discomfort significantly decreases the first few minutes of the session as the energy begins to activate the immediate pain blocking effect. The entire sequence involved delivering a specific number of pulses. It is important to remember that Shockwave is not a one-and-done treatment. The most successful treatment protocols have involved a series of 6 to 8 sessions, spaced a few days apart, and this spacing is critical to allow the body to adequate time to perform the necessary tissue repair and regeneration between the treatments. Patients should know that the goal is not immediate pain relief after the first session, but long-term regeneration and structural change that builds up progressively over time during the course of the full treatment plan and in the weeks following the final session. Chronic pain persists because the body has just given up on healing. The tissue is fibrotic, starved of blood, and stuck in a degenerative cycle. Shockwave therapy is your non-invasive, evidence-based solution to force that process to restart. It uses mechanical energy to promote powerful biological repair, increasing vital blood flow, dissolving calcification, and stimulating new, healthy collagen tissue growth. This is the definitive path forward when traditional rest, stretching, and pharmaceutical conditions and solutions have failed to resolve stubborn heel, elbow, or shoulder pain, or different trigger points in your body. If you're ready to stop managing chronic pain and start achieving true tissue regeneration, if you're ready to force your body to finish the job, well, it's time to explore the power of shockwave therapy. Don't let chronic tissue failure dictate your life and keep you doing the things that you love to do. Click the link below, schedule a consultation. Let's find out if shockwave therapy is the targeted regenerative treatment that you need to really just break the pain cycle, restore your health, and get you back to full, unrestricted function so you can do the things you love.